Hey guys, hey, how you guys are doing? Is you guys are doing? Cause I'm better than I was yesterday, obviously. Well, I have I'm going to the gym mentality, so that always makes me feel better. Like, regardless, I've had a massive headache all day, all day. I have a referral for a neurologist. My friend Jody had kind of cluster headaches, migraines to where she was unable to drive, unable to function, and I don't drive anyway. But the fact that I can feel one like coming across the back of my head, like it starts like literally right behind where if you trying to explain this to somebody else is like it's much harder than you think. So just imagine like my eyes here and then just going straight back. It starts back here. Madam, I said no. It starts back here and then it wanders across and then it'll stay about right here and then go through the front. So like it stays near my eyes. And we thought they were pressure headaches. We thought that they were sinus headaches. Well, honey, like we've stuck stuff up my nose. Like we've done pills. We've done damn near everything I could possibly think of to try to rule out migraines, and nothing is helping. And it's this eye in particular, and it's just a constant blur. So like I could see out of this one just fine normally, especially with my glasses on, but this one has like this aura, like how can I put it? You ever been flashed, before, like, the old timey pictures where you'd accidentally see the flash would hit your eye and then you have that kind of light aura still kind of in your vision, your field of vision. That's what this eye has when I start getting these headaches. And so I'm like, this number, and I need to put curtains up. But sitting in the dark makes me more depressed. But sitting in the light gives me more of a headache. So what do you do exactly? Like how do you find the balance? And like, I don't want pain meds. So I'm not looking for, what can I take to make me feel better, because I've already taken everything. Like, I've got Tylenol, I've got Roxycodone. That does zero for my freaking headaches. That does absolutely nothing to help my head. Nothing. And it gets to the point to where I'm nauseous, and like I take Phenergan, and Phenergan will usually knock out the nausea. Sometimes I have to take another kind, which is called Reglan, and that is, you're not supposed to be on that very often, but sometimes I have to take Reglan because Phenergan, I start off with Zofran, and if I can stop myself from throwing up, which I don't have a stomach. So you can imagine whatever I am vomiting is not something that I want in my mouth. Gastric juices, not so much. So this video is pretty much just about how this affects me, and maybe it'll help somebody else recognize the signs. Maybe it'll help somebody else who's going through this to know that, you can pull through it, and there are ways that I can deal with it. Because literally putting an ice pack on my face and just laying down, that does help. I won't lie. Putting it on the back of my neck, sometimes that feels amazing, but I'm just letting my life pass me by. Like, there's so much that I want to do. Like, I have to cook, I have to clean, I have dogs to take care of, I have surgery next month. Like, I'm going to be one-handed. There's things that have to be done and things that I need to do in order to prep for that. And I leave next week to go to a conference. So having a fucking headache is just not, it's just not gonna suit. Like, I just don't have time for it. I'm sorry. Like, my headache's got to be put on the back burner. And that's what a lot of things I wanted to talk about today is that lots of people can be in pain. Okay, there's all types of pain. There's stabbing pain, there's, throbbing pain, there's shooting pain. There's, like, I was watching Martina and Simon, and she has Ehlers-Danlos syndrome, and, she talks about the kind of pains that she has, and, she has dislocations of her shoulders and all kinds of craziness. And for me, caffeine helps sometimes with the headache, but not all the time. And it has to be a massive dose of caffeine. A massive dose of caffeine. I'm probably able to take about 600 milligrams of caffeine and not be phased. That's how, that is how much of a tolerance I have built up. So when you go to the doctor and the doctor asks you, can you give me on a scale of 1 to 10, what is the worst pain you're in right now? If you look at them and you don't look like you're on death's door, if your heartbeat and your blood pressure and your oxygen saturation is not sky high or not dangerously low, and you look at him and you tell him you're a 10, this becomes the problem. A 10, let's start with a 4, okay? I'm not even gonna, 1, 2, and 3 is just an annoyance. A 4 is where, you're starting to become uncomfortable, okay? It's nagging you. Whatever, if it's shoulder pain, let's just pretend it's shoulder pain, and I'm ignoring my head at the moment. Well, I'll get to that later. So let's just say that you pulled your shoulder a little bit, and it's not so bad yet. It's not the worst you've ever had. It's not so bad. So it's annoying. And you go to pick up something and, oh God, well that hurts a lot. Well, shit. And then that pain doesn't go away. Let's say that it is a throbbing and a burning pain, because it burns and it just throbs and it's just aching, and you're like, oh, you can't ignore it. That is a 4 working its way to a 5. Working its way to a 5. Once you hit to a 5, that's when they start paying attention to you, because that's when something may be wrong. Okay, when you tell people that you're sitting at a 5, you're like, I can't ignore this. This is not something I can ignore. This is bothering me. This is upsetting me. This is hurting me. I need somebody to take a look at it. So you're sitting at a 5, and then all of a sudden, like, it feels like somebody has just stabbed a white hot poker into whatever wound you happen to have. You're throwing up. You're starting to get nauseous. You're starting to have that panicking feeling of something is definitely wrong with me, and you're sitting at a 6. You're sitting at a 6, and then all of a sudden that pain is starting to radiate, not just from here, but like to the other side, and maybe your chest, and maybe you're having a panic attack because it hurts so bad. You're throwing up. You can't see. You're hitting a 7. By the time you hit 7, you're already in the ER, honey. By the time you even hit a 6, most people are smart enough to get somewhere where they need to be looked at. When people come to the ER and stuff like that, they look at a lot of things. And I know that there are medical people who watch this channel, and please help me out here, because it does help. It helps a lot when people understand the pain scale, when people understand what you say matters on how you're going to be treated. If you walk in and I look like this and I'm just like, I'm sitting at a 10, they're going to be like, I'll be back in a minute. And then you're going to sit there for like 90 hours in the ER, because they're not going to pay attention to you, because you're obviously not a 10. You're either A, looking for drugs, or you don't know what you're talking about, or B, you're the calmest 10 that they've ever seen in their entire life, and you're some kind of miracle that just dropped out the damn sun and you know, you're transcended into godlike powers, because a 10, you know, most people are gonna code. They're gonna die. You've been mauled by a bear and half of your body is hanging loose. That is a 10. A 9 would be like you've just been hit by a swarm of bees inside your eye sockets. Like, do you see what I'm saying? That's how bad it should be. It should be, that really fucking hurts. I don't feel good. I broke my leg, kind of hurt. Even when I broke my ankle, and I didn't even know I broke it. Even when I broke my ankle, I walked home on it the next day. It was so swollen and hurt me so bad to even step on it. I never said more than a 7. I was like, that really fucking hurts, but I ain't gonna die from it. I broke my ankle. Like, I have a horrific headache, but I'm not gonna die from it. When I start throwing up and I get vertigo, I push 6. I rarely ever push a 7. And there's a reason for that, because those numbers matter. How you're going to be treated. If I start telling them and they're looking at my blood pressure and it's like 127 over 70, and my pulse is like 86, and I'm sitting there telling them I'm sitting at a 7, either my blood pressure and my heart rate run real low for that kind of pain, or they're going to think I'm a drug seeker. They're going to think there's nothing wrong with me, and they're not going to treat me the way I need to be treated. And that's the most important part of all that I'm trying to tell you right now. I'm not telling you that you're a drug seeker. I'm not telling you that your pain isn't real. I'm not telling you that your pain can't be different than somebody else. So what feels like a 4 to me might be a 90 for somebody else. But I am telling you that when you go to the ER, or when you go to emergency care, or you go see your doctor and they ask you about that pain scale, how you're going to be treated and what they're going to look for is based on that. It is based on exactly how much pain you're in. If my blood pressure is reaching, like 180, I'm probably stroking out. Like, I'm in so much pain, I can't even think. If my blood pressure is like 132, like, my doctors are like, what's wrong? Because my blood pressure runs pretty low. It runs in the 120s to the 100 and like 10 to 120, 27 the most. So when I peak over that, they know that I'm not feeling all that great. But that lower number being really high, that's also a big deal. I'm not telling you that your pain isn't as good as somebody else's, and I'm not trying to explain to you that, because somebody in the comment section is going to be like, well, everybody's pain is different. Absolutely, everybody's pain is different. But if you want to be treated and you want to have them take a look, which is what I have to do when I go to the neurologist, I can't look at him and be like, every single solitary time I have a migraine, it's a 10. I can't say that to him, because he's going to be like, brain tumor, or she's stupid. Like, I can't do that. Now, whether or not it feels like a 10, I would be in the ER all the time. I would. There's a lady that's on here all the time that has what they call the suicide disease. It is, I can't think of, she'll probably write it down, where the pain is so horrific that people kill themselves because it is that bad. That bad. You can look that up. It's the headache from that is so bad that people will actually commit suicide because they can't get the relief. There's nothing that can be done to make it feel better. So that person, when they walk into an ER, they're not walking, number one, and they're screaming and they're begging and they're pleading for death because they hurt that badly. And then I walk in there with my, my size 6 migraine, and I'm like, I don't feel good and I'm nauseous. Who's more important in that ER? Like, do you see what I'm saying to you? Are you picking up what I'm putting down? Are you and I on the same page here? Like, do you get what I'm saying? Where's that damn camera? You in there? And I'm not really trying to tell anybody anything that I don't follow myself, because I had to learn this the hard way, especially in pain management. If you don't tell them how you're hurting, if you don't tell them the way you're hurting and you don't tell them the number, then they cannot help you properly. They won't know what to look for. They're going to give you the basic treatment. They're going to give you a band-aid on whatever it is to get you out of the office, because they're not going to realize exactly what's wrong with you. Had I just gone home when I had the epiploric epididymitis, where I had a twisted piece of my colon, had I just gone home and, I just went in there and I was like, yeah, my stomach hurts a little bit, I don't feel good. No, my stomach hurt so bad that I was miserable. I could not sit still. It was radiating into my back. I thought I had, because that feels like an appendicitis. Like that, a lot of times people will have their appendix taken out because that pain is in that area and it is that intense. So even though I refused pain medication because they had to get an ultrasound of my stomach, they had to give me pain meds. They were like, I can't do anything for you if you can't sit still. And I was like in so much pain. But even then, even with that kind of pain, I was still like 7, but breaching going on an 8, and I'm in tears. There's snot running down my face. I look like death's door. I was like, I've never been a 10. I've never been a 10, because for me, I'm like, I couldn't imagine being in that much pain. I couldn't imagine telling them that I'm a 10 unless I've been shot or been thrown out a window, or I was in a car accident, or I've severely broken my leg in like 15 places. Like, I can't imagine being in that much pain. And people who are usually at a 10, they're not at a 10 long because their body goes into shock. Like 10 is the worst you can get. Like 10's 10, baby. Like, I'm just saying is all. I'm gonna have controversy in the comment section, and I'm fine with that, because this is my channel and I could tell you how I feel, and I'm an expert on me, and that's all I could tell you. I'm not a medical professional. Like, I'm not a nurse, I'm not a doctor. I'm telling you what I know to be true from what I have experienced, and you are experiencing Nirvana, because that's the name of this channel, Experiencing Nirvana. So I'm telling you what I particularly experience, and what I experience is that if I go in with the mentality that I'm sitting at a 90 when I'm literally probably just sitting at a 6, they can't help me as well as they could if I was a little bit more understanding and a little bit more honest, and I could say, my knee hurts, but it is throbbing and it is giving me shooting pains all the way down to my toes. It's like an electric shock that goes well, that's neuropathy. That's something for them to look at. I'm dropping things with my hands. My hands cramp. I have problems with my fingers going numb. Well, that's my ulnar nerve. These 2 fingers go to sleep. I have compression problems with my carpal tunnel. But had I gone in there and been like, yeah, my arm just hurts, and I drop shits from time to time, this something around here don't feel so great, and I'm sitting at a 19, they can't really help me. This burns, it hurts, it doesn't feel good. I drop things, I have neuropathy. Like, it's annoying as shit, I'll tell you that much, but it's something that I can kind of ignore. Just like the migraine, there are times when I can't ignore it, and there are times where, like right now, I can feel it. It's sitting there. It's like right underneath the surface, but I know how to kind of take care of myself before it gets to that point. Like, I've already popped a Zofran, so I'm not nauseous right now. I'm already taking steps to have, I've got liquids, so I'm drinking and drinking and drinking. I know that I will be going to the gym in about 3 hours. I know that I'm going to go pick up my arm sleeves, so I'll be showing you guys my arm sleeves later. There's just a lot of stuff that I thought I would talk about today upon the pain scale, because I've gotten questions before, and I have actually been treated like a drug seeker when I've gone into the ER, because they saw I was in pain management, and then, when I go to the ER, I'm usually in rough shape. Something is definitely not right with me. And so I'll tell them, I'm a 6, pushing a 7, going around that area. And I've had them look at me because I've been in pain management and not want to help me because they thought I was there for just drugs, when I will legitimately tell them I have medication at home. I just want to know what's wrong with me. I just need to know what's wrong with me. I don't want anything else. I just need to know what's going on with me. Please don't treat me that way. Just because it happens to be in my thing, and I'm happen to be honest about it, does not mean that that's what I'm looking for. And a lot of people aren't, and it's very hard with the opioid epidemic now to have somebody who will listen to you and have somebody who will prescribe pain medication. It's very hard to get that, and I happen to be very, very, very lucky that I have doctors that are understanding, because a lot of people don't. A lot of people don't have doctors that are understanding and are willing to listen and that are willing to do the work to see exactly what's wrong with you in order to get you the help that you need. And I think that that is another thing that is super fucking important, is you need to be able to advocate for yourself. If you have a doctor that's not listening to you, either A, you need to go to patient advocacy, which means that somebody else is going to step in on your behalf, somebody else who's a professional and knows how to talk, or that you need to get switched to somebody else. Now, there's people who've told me before that they can't get switched to somebody else. I have never had an HMO. I have never had a situation when I was on Medicaid, I was either on Medicaid or Medicare when I was going through college, that they did not allow me to switch a doctor if we did not click. So if that means that you have to go to patient advocacy and tell them that your doctor's a dickwad, a twat waffle, an ass hat, then that's what you have to do in order to get yourself switched. But if that's what needs to happen in order for you to get what you need done, if they're not giving you the referrals that you need, if they're not listening to your pain, if they're not helping you with things that they need to help you with, then you need to find somebody who will. I am that person that will not stop. I will not shut up. You will not shut me down. I will get what I want until I will aggravate the living hell out of somebody until I get what I need. And that's how I get things done. That's how I got my gastric bypass done. That's how I got, my distal put in, is because I am relentless. If you give me a goal, you tell me, Nirvana, you need to get down to 200 pounds and I'll take every bit of skin off of you. I'll get down to 200 pounds in less than 3 months. Give me that goal and I'm like, okay, well, and by God, when I hit 200 pounds, I expect you to be on your end. Like, if you tell me that you're going to do something, then I expect you to do it. And, like, when a doctor is, well, Nirvana, I don't really know what's wrong with you, but let's try this. And, like, I tell them I'm allergic to that. And they're like, well, let's try this instead. And then I tell them that, well, I've taken that before and it doesn't make me feel good. And then they're like, okay, well, they keep trying something else. Like, they don't give up on me. They keep trying. And then if I find a doctor, and I have many, many times before, I have switched doctors many times. Many, many times. I've switched therapists, I've switched doctors, I've switched neurologists. Like, if you don't click with me, if I don't feel like you have my best interest at heart, if you think I'm a number or just a chart, then you and I are not going to work. I'm not going to deal with you. You don't need to bother with me either. And, you go spend your time on some other patient, and I will find a doctor that will work with me, who will understand what I need, and let them do their job, because I'm not there to tell them how to do their job. I'm there to get better. I want to be healthier. I want to be the best Nirvana I can be. And I can't do that if, nobody will listen to me. So you have to be your best. You have to be your own, advocate for what you want. So if somebody is not helping you in one way or the other, there are caseworkers. I have one. I made sure to have a caseworker. There are patient advocacies. I have one. You can get these. You just have to want to. There are grants. There are grants for skin. There are grants for all kinds of shit. There's stuff for money for people who have cancer. There are all kinds of things. You just have to look them up and apply. And people don't want to do that. There are churches that will bring food to your house when you're sick. Like, there are people that will legitimately go way out of their way to help you if you'll go and look for it. But people just don't want to do that. Like, they would rather wallow in self-pity. They would rather, suffer in one way or the other than to actually have to, how can I get some help? How can I get this done? How can I make sure that this gets, like, there are free clinics for teeth. Like, I myself need to go get that fixed. And eventually I will. But right now I'm having surgery on my hand. I'm about to leave. Like, then I'm going to have surgery on the other hand. Like, that is in later on. Like, there's so much more stuff that's more pressing than my broken teeth, But there are places that will do dental work for you for free. You just have to look it up. You have to apply for it. And if you're and they'll do a sliding scale. Some of them will legitimately do it for free. If everybody's retired and nobody has any money and, you're in dire straits and you've got really bad teeth, there are free clinics that will do stuff for you. There are dental schools that will do stuff for you. It might cost you a little bit, but they might pull your tooth. They might give you, crowns. You never know unless you apply for it. That's just kind of how the way I look at life. I'm like, if there's something that I need bad enough, I'm willing to put in the work to try to get it. Just because I know what it's like to suffer by myself, and I know that it's super important that, life is so short, guys. Life is so short to be miserable. It's too short to be miserable, and I don't want to be stuck in the house all day long in a dark room with something covering my eyes and me just praying that the pain stops. Some days I have to do that, but most days I try to just be like, okay, I have a headache. I don't feel good. Well, there we go. I have a headache and I don't feel good. Pop a Zofran, pop a Phenergan. If it doesn't put me to sleep, go clean the kitchen. Take the dogs out for a walk. Like, go for a walk. Lots of times going for a walk helps me a lot. I'll go for a 2-minute walk if that's all I can manage. But usually I walk a couple miles and come back home. So anyway, guys, I've talked for damn near 30 minutes today because I've just had a lot to say. I hope I haven't offended anybody. For those of you who actually make it this far, I appreciate it more than you know. If you are having pain today, if you are miserable, me and Yuki want to tell you something. That you are loved, you are wanted, you are needed, you are beautiful, you're amazing, you're compassionate, and you're kind. And you will make it. And it will be okay. And that you've made it through worse days than this probably. And hopefully tomorrow will be better. If you're having trouble mentally and you're depressed, know that you are not alone. Like, there's so many of us that suffer from this. There's so many of us that are miserable when it comes to being bipolar or manic depressive or just being depressed or having anxiety. You are not alone. There are thousands and hundreds of thousands of people who suffer from depression. There are hundreds and thousands of people. Come here, you. Come here. Oh, goodness. Come here. There are hundreds and thousands of people that suffer from depression and suffer from, having anxiety and being miserable. And I just wanted to tell you guys that you will be okay. And I'll be okay. And today is just one of those days. She's mad because I picked her up. She likes to just sleep. This is Saki. This is Yuki. These are my emotional support animals. Saki is 11 this year. Yuki is 7. And they are everything to me. If you don't know my dogs. That's right. You guys are everything to this mama. I cannot have children. We don't need to talk about that because that'll just make me boo-hoo. So this is the best thing that I've got besides kids. So anyway, guys, I love your beautiful, gorgeous, amazing faces. I really do love you. You are needed. You are worthy. And you are definitely enough. Please understand that. Know that you're, today Today will get better, one way or the other. You know, find something to laugh about, watch a movie, go take a tiny walk, find something to read. Just sit here and pet your dogs or your cats or your fish. Maybe not pet your fish, that might be a little weird, but watch fish. Just relax yourself and just know that I love your beautiful, gorgeous, amazing faces, and I will talk to you very, very, very soon. Mwah. Bye.